Thank you very much, Dr. Sushil Jindal, Dr. Banjal, my friends, the chairpersons, Dr. Hari Prasad and Dr. Sudhir. In fact, first of all, I would like to congratulate all the COVID warriors because they have actually saved so many lives over these past 1 year. And in fact, almost like a caregiver burnout is there because we are all very, very overworked. And now, again, big, I think everybody deserves a round of applause. Now, coming on to the topic of endocrinology of substance abuse in sports. As Dr. Abhyuday was saying that I actually have a very close association with sports all my life. I've been playing lawn tennis, football, athletics, and the crux of or the basis of bedrock of all sporting events is fairness. There is no cheating. So that is why when you are talking, they talk about the sportsman spirit. When I was reading, I came to know that it is a big epidemic which we do not know about, probably bigger than what we are facing now, because there is a whole generation of youngsters who are lured into taking these drugs, and most of them are not elite sports persons that I'll be discussing. Before I start, I'll start with a small story, two stories. I went to my friend's place, and his brother is a dress designer, and the brother was well over 6 feet 2 inches. While talking to him, he took me aside and said, which is the best lab to get a IGF-1 level done? I said, why do you want an IGF level? He said that he's taking growth hormone daily for the past 6 months, 3 international units every day. So I said, why are you taking growth hormone? Bole, it has been advised to me by somebody in Mumbai who's a celebrity trainer. So I was actually, at that time, this was like almost 6 years back, I did not know that growth hormone is actually used for bringing about these changes in the body. Then the second story is about a young gym trainer who came to me in the clinic, and he says that he has difficulty in erection and libido has gone down. I said, he's absolutely healthy. What is the problem? Then he told me that he has been taking testosterone 500 milligrams every week for almost 2 months. And after that, he will go into what is known as a PCT cycle. And he rattled out all hormones. And I was amazed at his knowledge about tamoxifen, anastrozole, HCG. So PCT is the post-cycle therapy which they do so that they wash out all the testosterone from the body. And then I said, they know so much, and so much of research has gone into this. The problem is that doping is not only in the elite athletes. Your neighborhood gym will have so many kids taking all these drugs, and most of them are available over the counter. In US, it is estimated that 3 million users use performance enhancing drugs. But then these are basically image enhancing. Everybody wants 8 packs like Shah Rukh Khan, which he had for one movie. I'm sure something would have been taken at that time as well. This is a Times of India headline. 157 athletes caught doping, and a record punishment was handed out. This also done in a Ranji Trophy tournament. So there were several players who had represented India who were caught doping. Celebrities in the field of sports have all been implicated in doping. Louis Armstrong, Shane Warne, Maradona, Sharapova, and who can forget, this is the first time in 1988 that we heard about stenozolol. Ben Johnson took stenozolol in the Olympics and he was disqualified and his gold medal was returned. The first reports of doping go back to 1888, where there is Charles E. Brown Sicard, who used extract from testicles of dog and guinea pig, and he felt that strength, intellect improved. In 1988, in Tour de France, a physiotherapist was caught with 400 bottles of erythropoietin, growth hormone, and steroids and amphetamines and narcotics and stimulants. And can you imagine? We know that Louis Armstrong is a legend in cycling, and he has been stripped of all his titles because of using erythropoietin to increase his red cell volume. There are some endocrinopathies which can lead to better sports performance. We all know Khali, probably he had a pituitary macroadenoma. And then it was found when they did a screening that more number of women who were athletes had PCOS. Yesterday we were discussing about PCO. So PCO testosterone is higher. So probably that gives them slight an edge. But then it is not doping. It is a natural condition. Similarly, there was controversy about a sprinter, Duty Chand, who actually was disqualified initially, but she fought in the arbitration court and she got back her title. Now, what is the market? I was trying to see what is the market. There is no estimate about what is the market for doping, but can you imagine that the anti-doping agency spends $250 million to $500 million every year just to do the tests. So the market has to be at least 10 times bigger. And advertising in sports is like a 2.5 billion for FIFA. So you can imagine the money involved. Now, this is a timeline, although the slide is smudged, so you can probably not. So I've highlighted what is important. So what this is from, there was an endocrine statement on doping and steroid use abuse in sports persons. Now, they have mentioned that these youngsters are lured by films like Rambo and Conan the Barbarian. And then who are the followers? And can you imagine, there was a screening done and it was found that 6.6% of 12th grade boys were using anabolic androgen steroids. This is in 1988. So you can imagine the scope of problem, Louis Armstrong. And then there was this Norwegian terrorist who killed 77 people. He was on anabolic steroids. Now, when was the first time performance enhancing drugs was taken? So I got this from historically perspective. Now, if you all remember that Queen Gandhari asked her son Duryodhan to come before her, wearing no clothes, so that she could look at him and give him power so that nobody could defeat him. But then at that time, there was this Lord Krishna who actually tricked him into wearing that loincloth, and then we know that that Bhim struck him on this jangha, and then so he lost. So probably this is the first time we came across, and then of course you have the Sanjeevni Booty and all. And not just that, players may actually spike the drinks of other players to bring them down and cause disqualification. Now, components of sports performance, you have skill, strength, stamina, and recovery. Recovery is also very important. Most of us, like Dr. Hari Prasad, who runs full marathons, and Dr. VP Pandey, who runs full marathons, they know that recovery from a run is very important. And you have drugs to help you recover. There are drugs which help you improve stamina. There are drugs which increase muscle strength and muscle volume. And skill. So for skills, you can have drugs which reduce anxiety. Benzodiazepines can be used by archery. And strength, you can use anabolic steroids. And growth hormone and growth peptides. And for stamina, you can use endurance sports. They use erythropoietin, autologous blood transfusion, and homologous blood transfusion before the event. And I was also amazed that they could increase their hematocrit so that oxygen carrying capacity increases. And then, of course, you can get beta blockers, stimulants, amphetamines, androgens, stamina. You can have your blood doping, which is there. Blood transfusions, erythropoietin, biosimilars, and growth hormone and releasing peptides. Now, these are the prohibited substances. Now, what are SARMS? They are known as selective androgen receptor modulators. Now, the problem with using this testosterone and other molecules is that they act both on, they have anabolic effects and they have androgenic effects. For example, the androgenic effects may cause erythrocytosis, may cause prostate enlargement, may cause acne, may cause depression, testicular atrophy. So if by some way the scientists have been able to decouple it. So for example, you have SERM, selective estrogen receptor modulators like tamoxifen and clomiphene. You have SARMs, which have more anabolic and less androgenic action, especially if women want to take it. So these scientists who are working for the doping agency are a step ahead of all those who want to prevent it. That is the WADA. Now, so there is something known as stacking and pyramiding. If you go to your gym, I'm sure most of your trainers may be using what is known as stacking, in which they have a cocktail of anabolic steroids. They may use growth hormone, they may use diuretics, they may use stimulants. And there is pyramiding. And just before the event, for example, if they are professional bodybuilders, before the event, they bring it down. They use diuretics so that their weight reduces and they have more. For example, if they want 8-pack abs, they use steroids. What are the various testosterone, the esters, which we usually give to our patients for replacement, are the ones which are most abused. And I was surprised to know even drugs which are approved only for veterinary use are very popular with the sports person, that is boldenone, which is only for veterinary use and it has been used. And then, as I stated, that scientists working for them are one step ahead. So how do you detect testosterone doping? You do a testosterone to epitestosterone ratio. Now people have started using epitestosterone to bring that ratio to normal so that they are not detected. And non-athlete weight lifters are even more. So most of these boys do not compete in specific events, but they are taking it for their self-image. So this is the Facebook culture where you want to show your 8-packs and your biceps, and then these non-athlete weight lifters will use this various anabolic steroids. And small tweaking of the structure. For example, if you removal of the 19 methyl group increases the anabolic activity relative to androgenic activity, which I was talking to you about, gives you nandrolone, is a popular training drug. Then stanozolol, again, very, very popular. 17 methyl substitution leads to molecule resistant to pre-systemic metabolism, leads to, and it is orally and it can be taken injectably. But the problem with sulfa 17 alpha methyl groups is if they are used, they are hepatotoxic. Now, what are the adverse effects? Now, few years back, there was death of various cyclists while cycling in the when they were doing intense workouts, and it was found that they were using erythropoietin, which caused blood viscosity. Similarly, they did a post-mortem analysis of athletes who knew that they were taking anabolic steroids, and they found that their cardiac volume was more when they adjusted it for height and their body mass index. So there can be cardiomyopathy. We know that atherosclerotic disease can be there. There can be cardiac conduction abnormalities. Erythrocytosis, we know, that is why we keep doing erythrocytosis. Now, there is something known as what anabolic steroid induced hypogonadism. This is what my patient was suffering from. If you use a very large dose of steroids, the intratesticular volume of testosterone reduces, the production goes down, the testicular atrophy can be there, and the endogenous testosterone production goes. And then the patient witnesses what is known as AISH. And it takes almost 24 months to recover the sperm count in such a patient. So if the patient comes to you in clinic and has been on large dose of steroids, then you may have to wait for almost a year or 2 years for the complete removal of that exogenous. So something like when people use exogenous steroids, people with rheumatoid arthritis, and we know that there is suppression and we give stress doses. Similarly, the endogenous steroid suppression goes. There is also something known as brain reward system, that when they do use anabolic steroid, they become dependent on it. Then, of course, hepatic side effects, musculoskeletal side effects are there. As I stated, my friend who came to me with, he told me that they use HCG. He actually pronounced HCG and told me that 2000 IU alternate day we take for a month. So that, and then we use tamoxifen or anastrozole with it so that there is no gynecomastia. And he knew everything about using these drugs. And of course, sometimes they actually use phosphodiesterase inhibitors if they have problems with erectile dysfunction. So in women, there is suppression of gonadotropins, anovulation, amenorrhea, dysmenorrhea, infertility, hirsutism, alopecia, atrophy of breast, tri, acne, clitoral hypertrophy. All this is seen. And then, of course, there is a bad habit of needle sharing that can lead to infections. All when we were studying our medicine, we read about hypothalamic amenorrhea, stress, malnutrition, and intense exercise leads to hypothalamic amenorrhea, leading to amenorrhea and irregular cycles in women. So as it is, women who are competitive athletes may have irregular cycles or amenorrhea. Coming on to growth hormone. Now, recombinant growth hormone, which we used, is used for doping, which I was introduced to one of my friend's brother who actually used it. And of course, what are the side effects? Whatever you see in a patient with acromegaly, you can have cardiomyopathy, you can have heart failure, hypertension, skin tags, maybe malignancies as well, coarsening of skin, acral enlargement, carpal tunnel. So when you see a bodybuilder, you can actually see the change in his faces. Erythropoietin was brought forth after Louis Armstrong was caught taking it, and it is rampant. So what it does is increases red cell mass and net increase in oxygen delivery to the muscle. So endurance sports, for example, somebody is cycling, say 600 kilometers or something like an event of Tour de France, they have to cycle thousands of kilometers. So they use this. But the problem is then they can have thromboembolic events, which some of the actually riders had. Now, how do you detect this? Now, anabolic androgenic steroids. So basically what they do is to do a testosterone to epitestosterone ratio. It normally is 1:1. In doping, if it is 4:1, it is called doping. But as I stated, they have started using epitestosterone now. Liquid chromatography tandem can detect stanozolol and clenbuterol. Which we know that this method detects most of the agents. And then you may have gynecomastia in your patient. The patient may confess to using it, or hematocrit may rise. All this can also be seen. The problem with growth hormone is that the 22 kilodalton GH is different in the one which is taken exogenously than the pituitary one. And then you can see the two, and there is suppression of the pituitary protein versus the one which is taken exogenously. And this also shows doping. In erythropoietin use, they use urine-based method of different erythrophoretic mobility because the exogenous erythropoietin uses Chinese hamster cells, whereas the endogenous is obviously our own body. So that can be distinguished by using a urine sample. And then I came to know about the autologous and homologous blood transfusion. So how do you do that? Not much methods are available, but then now each athlete is given a athlete passport. This is known as athlete biological passport, and he's tested at various intervals to see his hematocrit, reticulocytes, and hemoglobin. And if they find that just before the event his hematocrit has risen and the cutoff is 49, we see several patients coming to us with polycythemia, especially smokers. They have a hematocrit touching 50. So if these athletes have high hematocrit, they are caught. So what is the way forward? So I think prevention through education is most important. Unless we tell these children, they are going to have lots of problems in life. And if you go to your neighborhood gym, you find out, and even those whey proteins and some other proteins which are available, creatine and all, may have these agents which have not been listed in the contents of that box, and they may be taken, and the person feels better, he tells the other person, and there everybody is actually taken in that net of doping. Detection and staying a step further. So you have labs in Russia and Germany. In fact, it was German doping was state sponsored. Even Russian doping was state sponsored. So, and then WADA actually came down heavily on these. And we know that Russian athletes were banned for some time. So treatment is to restore the bodily homeostasis, whether if there is testicular suppression, HCG is used, you want to give tamoxifen for your gynecomastia, and of course the side effects have to be taken care of. And the future now of doping is gene doping. They may use performance enhancing genes. And what are the candidate genes? Erythropoietin, human growth hormone, IGF, androgen receptor. So this is my last slide. Health is a crown over the head of a healthy person. Only the sick can see. Live a healthy life. In fact, we are the torch bearers. If we are healthy, we can promote and dissipate and enlighten others to be healthy. Thank you so much.